Hello, everybody. I welcome you to my channel. Do you want to start a home health care agency in North Carolina State? If that is the case, then this video is for you. Do not go anywhere. All right, I welcome you to my channel. Thank you so much for coming and stopping by. I hope this training session will be very, very beneficial to you. If you watch this training step by step, I believe that you'll be able to submit and apply for your home care license in the state of North Carolina. Now, let me remind you that I am a consulting agency here in North Carolina. And so if even after watching this video, you feel like you still need more guidance, someone to hold you by the hands and help you do the application and get set up, get approved, and get your agency running, look in the video description and get in touch with my agency. All right, let's get into it. So I have listed here in this document, step by step, how you will set up your business, your home care entity in the state of North Carolina. So you need to start by visiting the website here, and I will list all these links in the video description. When you visit the home care licensure and certification section of the North Carolina Division of Health Service Regulation website, you will find every detail information that you need. We are going to visit there right now. I'm taking you to that website so we go through that. Before you go there, you would want to sit down, come up with the name of the home care you want to create. And then you have to search it up on the Secretary of State's, the North Carolina Secretary of State's website to make sure the name is available to you and it has not been taken by another company or organization. So there are three places you can search the name that you want to use for your business. Number one, go on google.com and then search that name. If it pulls anything within the state where you are, you cannot use that name. Number two, go and search on the North Carolina, the state where you are. Search the Secretary of State's business registration of business site. Okay, and here, when you click here, this is where it takes you. This is North Carolina Secretary of State. So registering a business. Okay, you are able to find out whether your business name has been taken or not. After you register the business, remember to file business annual report. Here in North Carolina, I believe it's every April. The April month of each year is where we file the business annual report, and it's $200 plus taxes. As of the time and date I am making this video, it is $200 for your annual report to file. So you can see that it says register your business online. I have a full tutorial on how to do that. You can search in my videos on my channel. If it's public, you'll see it. If not, it might be part of my training course videos. All right, let me go back to this. So after doing that, you come up with your name. You have your name registered I believe as of the time I'm making this video, the registration fee is about $125 plus tax. Don't quote me on it, but that's the figure I remember. So you can launch your business and set it up there. You don't need to pay $800 to anybody to create your business, set up your business with the state. You don't have to do that. Beside this video that I'm making, I have also made a video about registering, how to register an LLC for your company. It's either in one of the videos here on my channel or it's inside my training. And many people have made those videos also available. You can watch it and watch it till you get understanding and then use it to do the same. I'm making this video because not everybody can afford to pay a consulting agent, a consulting person like me to help them or hold their hands step by step. So whether you have the money starting your business or not, I strongly think you should still be able to set your business up anyways. So after doing that and paying with the Secretary of State, you go to irs.gov and apply for your EIN, Employer Identification Number. I've also made a video about this, how to do that. So after doing this, now you come here to the North Carolina Division of Health Service Regulation, and then you look for acute and home care licensure and certification session. Now let's go there. So this unique link will be in the video description for you. Resources on this page provides links to applicable rules and regulations, relevant forms for licenses, and applicant steps that must be followed to obtain a license for a home care agency. So I will show you what exactly you are looking for. Now we have the medical and non-medical. You can apply for both medical and non-medical at the same time. I'll repeat it again. There are so many rumors, so many people that spread misinformation that you have to do the non-medical first, then later you go and apply for the medical. It's never true. It's a lie. It is never true. Read again. It is never true. It is a lie. So when you are here, okay, so let's come to the licensure information. So what are we looking for here? We are looking for license application for home care, nursing pool, and hospice. This is what you need. License application for what? Home care, nursing pool. When you hear the word nursing pool, it also means staffing agency. If you want to start a staffing agency, healthcare staffing agency, the application is for nursing pool. That one, if that is the only thing you want to do, this nursing pool, you don't pay application fee. It is free. But the home care, you will have to pay $560. All right, now let me come to it. Here, I'll open it in another thing. So it will open this application for you. Now, when you are doing it for the first time, you're going to choose initial. You use your black marker. You print this out. Use your black pen to choose initial. Okay. And then legal identity of applicant, owner, corporate identity. You put your full name here. You put full legal name of corporation or partnership individual. So the full name of your business, you put it here. Agency name, doing business as, you can put that here. Okay, so I'm going to be using an agency called All Grace Healthcare Solutions, PLLC. So if you put that here, it is also registered as doing business as All Grace Healthcare Solutions without the PLLC. So either those two names work. So if yours is like that, you can put the one with the LLC first and then the one without the LLC second. But if you don't have any doing business as, and doing business as, this comes from when you registered the name at the Secretary of State website. So at the Secretary of State website, when you are registering, you can have the full name of the agency and then a short version of the name. That is what we call DBA, doing business as. It is the same company, but you can shorten your name as well. So whenever anybody see the shortened name, is still the same long name for the agency. I hope that is clear. So you put agency mailing address, agency site address. This should be the same, hopefully. If perhaps you have bought a virtual address and you're using it as your mailing address, this is where you put it. And the agency site address is your home address. This is where you put it. But here in North Carolina, they want you to have an actual office. They want you to register an actual, rent an office for your agency. You can't do it from your home. So please understand that part. You cannot do it from your home. It has to be from a rented place. And that is what you put here and there. All right, let's move on. Administrator or director. Now, let me explain this part. If you who is doing the business, if you starting the agency, if you are not a registered nurse, if you are not the registered nurse, the director has to be the registered nurse. Okay, so if you are not the registered nurse, don't put your name here. Put the person you are hiring to be your director of the nursing department. Put that person's name here. So put your name and your title. So if your name, the nurse who is going to be the director is called an associate degree nurse, can do it. Either associate degree nurse, bachelor degree nurse, master of science degree nurse can be the director. But if you're a CNA or a caregiver, you are not a registered nurse. Even an LPN cannot be the director. A licensed practical nurse cannot be the director. It has to be a registered nurse. Please take note of that. So if you are a CNA, a caregiver who is starting your own agency, you would have to hire a registered nurse. Bring the person on board because you need that person for your application. Okay, let's move on. You put the person's title as director. License categories. Here you will choose home care agency. If you are doing staffing agency, then you will choose nursing pool. If you are doing both staffing and home care, you can choose both. Check all that apply. Remember, it says check all that apply. It means you can choose two. If you are doing home care agency and hospice at the same time, choose two. If you are doing the three, choose all the three. Okay. If you choose one and later go and add, you will pay another set of fee, and you don't want to do that. Okay. Scope of services. Here is very important. Are you going to do the medical with the non-medical or just the non-medical? If you are starting out with just the non-medical, it means you are not going to provide any wound care services, any infusion services, any diabetes management, anything that is skilled services is part of the nursing services, whether you are giving administering medication or or infusing normal saline blood and so on and so forth. All those are part of the nursing services. But if you are not going to do any of that, that will be the in-home aid services, which is also called the non-medical services. So if you are starting with just the non-medical, this is what you choose, in-home aid services. However, if you want to do both, you can apply for both at the same time. Do not do this one first and then go and do the other one later. It is not necessary. You'll be paying two application fees if you do that. So avoid that payment of paying 560 and then going to pay it again. You will be doing yourself a disservice and wasting your money. So do this one first, the in-home aid service. If that's what you are going to be dealing with, fine. If not, and you're going to be doing the medical, choose both. I hope this is clear. And if you are also applying for nursing pool, choose yes. Nursing pool, you don't pay anything. There's no application fee for it. I hope that part is clear. All right. So let's move on here. So you choose that in-home aid service, scope of service, in-home aid service, companion sitter respite care. Yes, you're going to be doing that too. That's all for the non-medical. An applicant must be able to complete all necessary requirements within 1 year from receipt of initial application and fee date to obtain a license. So they want you to make sure you have everything ready. If home care licensure is being requested on the basis of deemed status as an accredited agency, attach a complete copy of accrediting organization's inspection report. Okay, so if you have any of this accreditation stuff, then that's what you deal with. If not, this one can be obtained later after you've done your agency for a number of years. You can, work towards getting accreditation for your organization. It's quite a process and it takes money to do that. If Medicare certified home health, what is your provider number? This agency is a home health agency. Please check one. So you're going to choose parent. Okay. Some people start their agency as a subset of another agency. So if you go under Maxim or under Bayada or under any other, you become like a branch or subunit. But if you are starting your own agency with your own unique name, then this is what you choose. You will take this one. All right. Hospice applicants. If Medicare certified, what is your hospice provider number? So if you're a hospice, this is what you're going to be providing for them. Okay. Today is not for hospice, it's for just home care. Nursing pool applicants. Nursing pool applicant must attach a copy of the written administrative and personal policies governing the provided services. Initial applications only. So if you are doing a staffing agency, the initial application is quite different from the home care. So I'm going to add this because I've done it before and help others to do the same. So right from the onset where you are sending your first application document, that is when you're going to add your written, administrative, and personnel policies. But for the non-medical or the medical home care service, you don't do that. You don't add your administrative policies. You don't do that. You just send in your application document plus the other requirement, which is the job description signed, orientation paper signed, two, at least two potential employees and their background checks done and everything. But with the nursing pool or the staffing agency, you need to add to the initial application your administrative, your policy and procedure for that staffing agency. All nursing pool applicants must attach a copy of agency's current general and professional insurance policy, binder acceptable. The document must show that the applicant is insured against loss, damage, and expenses related to death or injury claim resulting from negligence or malpractice in the provision of healthcare by the nursing pool and its employees. So for this one, you can get a cheap professional liability insurance for your staffing agency and for your home care agency. All you have to do is to apply to HPSO, this one here, liability insurance, HPSO. When you go here, okay, need a code. Are you a practice or business owner? Yes. Let's get started. Okay, so HPSO will get you something very, very cheap. Remember, do not put many employees, just put yourself as only the one single employee. You are your first employee. When you do that, you will get a very cheap quote. Okay, all right, let's continue. All right, so you within 30 minutes you should be done with this, and then you can add it to your application document that you are sending. All right, for here, ownership disclosure. So some people start this agency thing, maybe husband and wife, they go into partnership or just one person. So here you choose for profit because your agency is for profit. Okay, so choose for profit unless you are a non-profit organization. So block 1, for profit. If you are for profit, proprietor's name and your address, unincorporated individual. You are not an incorporated individual, so you can put your information here. Okay, you are an LLC. If you register your agency as LLC, it means you are not incorporated. If you are partnership, you put this information. You fill this part of the information. Partnership name. And the individuals on it. You put your name, your title, percent ownership. Then you put, if it's 50-50, you put. If it's 3 people, 4 people, and everybody is 25-25, you put. Attach additional sheet as needed. So you can attach an additional sheet if you are more than. This is for corporation, unit government. All these are not necessary for us. Multiple facility agency system. No, you will choose no for here. And then you put your signature, your name, your title, because you are the owner and CEO of the agency. You will put your title here as the CEO slash owner and the date you are filling this form. It's very important. If you are not an RN, you put your name, your, your title as the CEO and the owner. If you are not a registered nurse. However, the administrator and the director should be an RN. I'm telling you from based on experience. Okay. I hope this is helpful. Now here, service categories for home care providers. Here, you're going to list all the counties. And you can list up to 8, 7, 9. Provided the county is 90 miles radius from your business office. If the county is 90 miles radius from, how would you know? Go to Google. Type google.com. Okay. And then you put your business address and then you type counties that are 90 miles radius from that address. It will pull all the counties around to you. It will pull them for you. Then you list them here in each box. List them. So this is for nursing services. This is for infusion services. This is for in-home aid companion. This is what the non-medical people you are supposed to choose. Okay? So here in the in-home aid, this is where the non-medical, this is where you will choose. You mark here, here, here. You will mark all this section for all the counties and the companion and respite for all the counties up to whatever counties. If it's 7 counties, you will mark up from here up to 7 counties and here up to 7 counties. Remember, this is the section for the non-medical. However, if your application involves 2, both the nursing and the non-medical, then you will fill here and also there, leaving the infusion part, unless you are also going to be doing infusion nursing. Okay, in-house. So here they explain what IN-H means, and then CTRT. Okay, service provided by contract. So the service provided by contract means you're going to contract people to do it, but that's not what you're going to do. So the in-house is what you're going to be filling. The in-house is this one. It's just this one here. So if it's non-medical you are doing for this session here, this is the only one that you're going to fill. So if it's 7 counties, you fill up to the 7th county. I hope that makes sense to you. Put your question in the under the video, and I will answer you as much as I can. So this is just the continuation, the counties. This is just a continuation of the counties. Okay. All right. Once you fill this part, your application here, this part is completed. Now, what comes or goes with this application? You're gonna get a cashier's check of $560 as of the time I'm making this video. Okay, so a money order or cashier's check of $560. All right, and then you as the if you are filling this, if you are doing this agency business as a registered nurse, then good for you. You're gonna fill application for yourself as the director of the company, and then you will have to fill at least two other people, at least 2, if I'm recounting right, and I know I'm right. 2 people, at least 2 people. So you can get a CNA, get you a CNA, and you can get two CNAs and a PCA. PCA is personal care aid, who are willing to fill the application. So, what application? Your agency application. So, you need to get forms for your agency. If you don't have any, look in the video description and then you can get some from my online store. Very reasonable deal that you can customize, edit and add your business name and then use it to fill the application. So for you and for two other people, you fill the application, your company application, you fill the hepatitis B form or a waiver form. You do the TB skin test. So you can have a custom-made document for your agency, okay? And then have them come in and then you fill it out that you did a TB test on them and sign it for them. Or if they have done TB test with another company where they work, they can bring you that proof. You make a copy. You will need that. You will need a background check consent form. They have to fill that. You will fill one for yourself as the owner, and the two other potential employees will also fill that part up. You also do the license verification for the CNA, and then you add that document. You will also do proof of orientation document, reference check document. I've already mentioned the signed consent for criminal background check. You let them sign job description so they know their job description and what they are going to. So I'm going to show you the client document, employee document, operating document that you need for your business. All right, so after you have filled that form, I want to show you quickly. These are required forms that you will need for your agency. Client authorization for PCS, personal care service, rights and responsibility, abuse and neglect form. These are documents that you send to the client digitally to their email, wherever they want to receive this document. And you have to also keep it in a physical binder in their homes. They have to sign it, okay? They have to sign it, keep it in their home for future records. Okay, agency. These are required documents you must have. So for the agency, you need notes, nurse notes, complaint form, complaint log, in-service training log, agency annual evaluation, annual agency audit, RN supervisory visit form, QA utilization review audit form, client record sign out. These are all forms, document that is required, that needed. So if anybody is in need of these things, if you check in the video description, it will take you to the link where you can get this form. Very, very reasonable price. I don't overprice my things because I believe we have to help each other. So you can get that handbooks and manual. I also have the policy and procedure manual for non-medical, and I have the policy and procedure manual for the medical. So if you need one or the other, check in the video description for it. These are also the employee forms that are needed. The application form, consent for drug testing, healthcare registry form, reference check form, hepatitis declination form, skills check, annual employee. So which of these are you taking with the application? You need job description for the agency staff, RN, CNA, in-home aid. So you need it for your RN. So if you are the one who is the agency owner and you are a registered nurse, you need a job description form that you will sign yourself, that you are adding to your application. You need a CNA, at least one CNA or two CNAs. It will help you a great deal if you had two. And I would strongly encourage you, even if it's a PCA job, I will encourage you to hire more CNAs than PCAs, because CNAs are well trained, okay, and they have a license to protect and they will do the right thing. But a PCA doesn't have any license to protect. It's just my personal advice from personal experience. If you like it, fine. If not, you can forget it. Okay. So I've just listed the things that you need to add to your application. Job description signed, orientation document signed, and this goes for you and the potential employee as well. They have to sign the Hep B. They have to do the reference check document. It's a one-page document. It shouldn't be 2 pages. Reference check document. And for the reference check document, you don't have to actually call anybody. Just ask your CNA, whoever the CNA is that is working with you for you to apply. Ask them, to furnish you with names of where places they've worked. It can be anybody. Just put their name, phone number as the supervisor, and then put the date you call them on the reference check. Okay? The state is not coming to look, ask you a proof of what give me a proof of when you called. No, they will not do that. Just fill that reference check form for them. It has to have a date and agency name and a supervisor or somebody you called from that place. So let your CNA furnish you some name, a phone number, put it there. North Carolina State is not going to be calling those phone numbers for anything. It's not part of their job thing that they will do. Okay? So don't worry about that. The consent for background check. For the background check. So employee name, job title, date of hire, application, and resume. So remember, if you are an RN with the agency, you will need your resume. The CNA doesn't have to provide any resume. The PCA doesn't need any resume. But you, the registered nurse or the director, your resume has to be part of the application package that you are sending. So the job description has to be signed. The license verification for you, for your RN license, or for the director of service, that RN that you hire, if you are not an RN agency owner. You need to obtain their license verification. You also need to obtain the license verification for your CNA. Okay? And it's very easy. It is so easy to do the license verification. Let me see if I have the links here. Anyways, I'll be providing links in the video description. Website for lying seizure rules, required training. Okay, so one of the requirement, the checklist, they call it the checklist, nursing non-medical service checklist. So you will need to have required lying seizure training. Now, This required licensure training. Let me take you there and show you. So, on the North Carolina, their website, Health Service Regulation website, they have home care provider training. So before you send your package, your application package, they want you to they want you to attend a training session where they go over how to set up your home care agency, how to go on the North Carolina website like here and understand all the policies and procedures that you need, the rules and regulations governing the North Carolina home care agencies. The one that I highly recommend, which is the cheapest of all this list, believe it or not, if you call any of these or go to their website, let me just do one example for you. They are super expensive. 700, 800 is not worth it. Don't do it. Please do not do it. Don't don't go and pay that money to them. Okay? So home care line seizure course, consultation 300, administrator in training. This one teaches other things. But when you need this, it tells you how much they charge. It costs $500 for two people from your company. And then for additional is 300. So 500, even last year it was more than this. I think, I don't know, she reduced it. It was 800 or 700 or so. But today I see that as of today, I see 500. Okay, let me take you to another place. Here, if you go to Affinity Home Care LLC, who is also a provider, they also charges. Let me see where their services. Okay. Okay, I'm not sure which part of the training and consulting. Training and consulting. So, okay. So policies and procedure, they charge 1,500 for the initial policies. Nursing service, they charge 2,000. Infusion policies and procedure, 1,800 and 500. Startup agency templates. Okay. So all these templates that they are charging 500. If you go on my online shop, it's less than that. Here, home care provider training 475. Bundle and save initial policies and training 1,799. So they add this to here and give you policy and procedure. So for the policy and procedure, when you go on my online, it costs $500. Okay, it's cheaper than buying it for this or this. Nursing services, mine is 700. Anyways, 475. But what I want to show you here is that if you go with the top one, Kathy, if you go with Kathy and these people here, it's 400 and let me show you, 425. So you will save some money. The other lady, the other person, hers was 475. This one is 425. This is the cheapest you can find. The cheapest. And they also give you 1 year membership in their association where your agency is listed. When people are looking for agency, they can find you and call your number. Okay. So 425 covers for two agency representatives to come and learn. It's a 2-day class. Register online. It's virtual. After the virtual, the second day, they issue you the proof that you've sat under the training, and then you add that certification they give you to your application package. Listen, do not send in your application without taking this training. Line seizure, they call it line seizure applicant training. Line seizure applicant training. You will need this. If you don't have it in your package, your processing can delay. And the processing of this application takes roughly 3 weeks for them to do. So if they waste 3 weeks and then this is missing, it will take another 3 weeks for them to respond to you. Don't waste that much time. Okay? Time is very valuable and precious. Establishing a home health agency, home care initial survey checklist. So they go through detailed. They show you how to understand this website here, how to understand the checklist, how to understand the policy and procedure so that you can write your own policy and procedure if you have the time and the leisure to do. They show you all the things you have to look out for that you should include in your policy and procedure. Okay, let's see. So I've shown you the application. Okay, now let's look at the checklist. Adding an in-home aid service checklist. So this is what you need. Initial home care survey checklist. That's not what you need, even though you can look at it. Survey checklist. Okay. Home care initial survey checklist. So after you establish your agency, you are approved, you have a license, you get a client. The first day you get a client, the director of nurse has to go there and do the first home assessment of the patient and come up with a care plan for the patient and the services they're going to provide. The date that they go there and do the assessment and the care plan, 90 days after that, they have to use the RN supervisory document and go and do 90 days assessment again, 90-day review. Plan of care policy include 90-day review, you see. So these are the things that when the state come into your office to audit you, they're going to look out for the 90-day service review that you did on your clients. Always remember that. Okay? Always remember that when they come, they will check individual employees that work with you, the application, their resume. Resume is only for the agency director. Their assigned job description. So you have to have a separate file for each individual employee in your office. Keep them separate. Now, 2 places you can keep them. Keep them in the physical folder and also keep them in the cloud. Like have a business Google Drive where you have every employee's folder in individual folder so that you can pull it at ease. So you can scan anytime they come and fill application, scan it, attach it as a PDF, save it to the cloud, and then save it in their physical folder. This will help you a great deal. If there is fire, God forbid, in your office, if there is anything that happens at your office and documents are lost, you can pull them from Google Cloud and do what? And use it and print it out and have your backup copy. Okay, administrative policies. All these have to be up to date. These are all something that you should have, and make sure that every month, every week, you go on the website and see if any of the policies have changed. If they've changed, update your policy and procedure manuals. It's as simple as that. B immunization or declination policy required for all in-home caregivers. So your caregiver has to sign whether they waived the Hep B or they took it. Now, let me tell you this. You need to have a small fridge, refrigerator in your office. You can buy TB test solutions from any pharmaceutical company online and keep it inside your small refrigerator. You must make sure that you keep a temperature log paper, stick it in front of the refrigerator. Okay, and every day mark the temperature. You must have a thermometer inside that refrigerator. Every day take a log of that temperature inside the fridge for your TB solution. And for your drug screen, you don't need to send them to any state department for drug test and everything. You can buy 5 to 10 those drug test package. You can get some at eBay or Amazon or any cheap place. Keep them there. When someone come to fill application, a potential applicant, employee come to fill application, you say, hey, honey, can you go and pee in this cup for me? Don't flash. Stand by the bathroom. Make sure they put all their things in your office. Go with them. Stand by the bathroom door. Let them pee for you and dip the stick in. Do the drug screen, the drug test right there and then. And save yourself the time and energy. Because some people, when they go, they might not come back. Okay, but you can have the drug test done right in that office and get it over it. I hope this video has been very informative to you. Now let's back up here. So adding in-home aid service checklist. Let's come here. So these are the scope of service. So these are the things in-home aid. So you need the agency director. Service supervisor can be the same as the agency director. It's one of the two. In-home caregiver. So it can be a CNA. Okay, it can be a CNA. So you need all these employees, name, job title, application or resume. This is just for the director. Signed job description, license verification, proof of orientation. So these are the things. This is part of the package you are sending with your application document that I just went through with you. You fill the document for all this for one CNA or two CNAs, and then one for yourself. Add it to your application document and send it to the state with a cashier's check. And just in case you don't know their website, the address where you are sending it to, don't worry, I will get it right here for you. Okay, so here on this document, 560 is the application fee as of the time I'm making this video. It may change in the future. If you are watching it a year from now or two, make sure you go on their website and verify how much the current money is. And if you attend the licensure applicant training, they will tell you the current fee. So don't worry about it. You're going to mail it in an envelope to North Carolina Department of Health and Human Services, Division of Health Service Regulations, licensure certification, acute home care session. All this has to be on the mail for it to reach the right people. And then you add this to it at the bottom here. If you don't add it, you will not hear from them. That would have been a waste of your time. Add every detail of information you see here to it. Okay, so I think my video has been very long. I will make a part 2 video, and then I am going to go over the next step after you submit. After you submit, then you create your North Carolina ID on this website. I'm going to go step by step and create one, and then also get the NPI number here. I'm going to walk you through how to get the NPI number. And then they have the website for renewal. You need this ID number established before you can do the renewal online. I hope this was helpful. Look in my video description for all these links, valuable links. Also, stop by my online store if you want to have me as your consultant to help you. My fees are very reasonable. And if you take the package of consulting with me, then you get your policy and procedure, everything inside the amount that I will charge you. And it's very reasonable. You don't have to pay separately. However, if you just need the policy and procedure, also look in the description for it. Everything that you need, documentations for clients, for employees, internal operations, everything, I have them. You can just edit and it's very reasonable. I promise you. All right. Give us a thumbs up. Share with somebody who may need this valuable information. Keep coming for more because we're going to do more. Okay? All right. Signing out.